The masks, it's going to be really a voluntary thing. You can do it. You don't have to do it. I'm choosing not to do it.
I think it's a political hoax.
No, I don't wear a mask.
Shame on you for voting for a mask. And I say Trump 2020.
Not wearing a mask, because I don't need a mask.
How was something as simple as wearing a mask allowed to become political?
Open up!
I wish these people could just understand to use the brain.
Anybody that needs a test gets a test. They're there. They have the tests. And the tests are beautiful.
They said there's no way to get tested. We don't have tests right now. There's nothing set up in Delaware.
You know, very wealthy people have access to these quick turnaround tests, or they get ahead in line, and they're getting more of those overall tests.
Perhaps that's been the story of life. The virus will not have a chance against us. No nation is more prepared or more resilient than the United States.
The system is not really geared to what we need right now.
America is not prepared, and nurses are not being protected.
America is now in COVID hell.
The cover of the upcoming issue of Time magazine, 2020, the worst year ever.
And more than 200,000 COVID infections, also the most in one day. Right now, 100,000 Americans are hospitalized with the virus. The White House Coronavirus Task Force says the nation is in a very dangerous place.
This morning, Californians waking up to a new reality, bracing for a statewide lockdown affecting 33 million residents. After infections soared past 20,000 a day, hospital ICUs now dangerously close to capacity.
We had more cases this last week than we had in the entire month of October.
It was a picture that captured the pain and anguish on the front lines as a Houston doctor gave a moment's comfort amid so much uncertainty.
He tells me, I want to be with my wife. And man, when he said, I want to be with my wife, I just embrace him. I just hug him.
We do not have enough beds, and we do not have enough high flow nasal cannula. We do not have enough ventilators. We do not have enough ICU.
A lot of nurses are burnt out. I have access to hundreds, thousands of nurses on social media, countless comments, countless messages telling me I want to leave the bedside. I don't know why I chose this. Like, I'm so tired. I feel exhausted. I don't know what to do.
The reality is December and January and February are going to be rough times. I actually believe they're going to be the most difficult time in the public health history of this nation.
The US is accounting for a third of all world cases at the moment over the last number of weeks. The epidemic in the US is punishing. It's widespread. It's quite frankly shocking, to see 1 to 2 persons a minute die in the US, a country with a wonderful, strong health system, amazing technological capacities.
Señor.
I've worked in healthcare for my whole life. I always have told people that when you're sick, you should never think about the cost of healthcare. Doctors I know are not thinking about how much the cost of care is that they're giving, and patients should not be thinking about the cost of the care that they're getting. And certainly not in this moment, and not with something that could be deadly. So I wasn't thinking about the cost at the time. What I was thinking was I was really concerned that I might die.
We couldn't get sick. It was not an option because we will be coming home with like thousands of dollars worth of debt.
We know we must reform this system.
The whole point of this is to get everybody enrolled in the government health care.
By passing a health care program essentially on the strength of one party, it was fated, destined to become a continuing partisan divide.
We're not going to own it. I'm not going to own it. I can tell you the Republicans are not going to own it. We'll let Obamacare fail.
Here's a big issue for many of you out there, and that's health care. It's been a concern for a long time, but the coronavirus pandemic has really put a spotlight on that.
50 million jobless Americans have applied for benefits since the pandemic began, and nearly half of Americans get their health insurance through work. One study finds that an estimated 5.4 million American workers lost their health insurance from February to May.
What does it mean to lose your health insurance?
It means a lot. Some days you want to go to the doctor and see what else is wrong with you, but you can't.
We're just continuing to see people delay care because they are either newly uninsured or they're worried about being out in public with concerns of catching COVID-19.
The system was never set up to take care of everyone.
I think what the virus has done has been to pull the veil back from over some real problems in this country, some real divisions, class divisions, cultural divisions, racial divisions, religious divisions, you name it. These divisions have been developing for quite some time.
The vaccine's critical, but it's not going to save us from this current surge. Only we can save us from this current surge.
So like from 1 to 10, how satisfied are you with the way things are in America right now?
4.
3. 2. Like 2 maybe.
Like a 2.
I'm just very disgusted with everything.
Any of them government people ain't doing a good job. I don't care if you're a liberal, a Democrat, a Republican, they all got their heads up their ass, really.
And I don't like the way our Congress is bickering back and forth with the president and the Democrats when they should be focusing on COVID-19 relief for the Americans, and it's just things look grim.